Good morning, everyone. I'm going to talk to you this morning about the EU Joint Action Best Remap, Healthy Food for a Healthy Europe. And the particular work package that I'm going to discuss is best practices in reducing marketing of unhealthy food to children and adolescents. And as Catherine said, together with with Portugal and my colleagues there and 15 other member states participating, Ireland and Portugal are leading on this joint action. And I'll talk a bit more about that as I go through the tasks. I suppose the first thing I just wanted to say is how this whole process came about. So what happens is the EU often sponsor joint actions. And in fact, this is one of the largest joint actions that they've done in the area of nutrition. There's 6 million euros being spent on this particular joint action. And because we have a lot of interest and we have a lot of Eastern European countries participating, instead of the usual 60-40 rule, where the member state has to put up 40%, we only have to put up 20% in this case, and the Commission are giving us the other 80%. So, Best Remap, what does Best Remap stand for? So Best Remap stands for Best Practices in Reformulation, Marketing and Procurement. And that's why we have the capital letters in the remap. And how this particular project was decided on was the EU invited member states who already had a good track record in marketing to children, and 8 other subjects, including obviously reformulation, which the last joint action dealt with, and food procurement and other actions as well. And it invited the member states with the best practices in that area to come and present at what they called a marketplace in the Commission. And all the member states were there, and they went to all the different workshops over 2 days. We split them so they could get to everybody's. And marketing was one of the key workshops or subjects that was chosen. Now, when we did the presentations, it was Ireland and Slovenia who were invited to do it, but actually Slovenia have ended up overseeing the entire Best Remap. So we have asked Portugal if they would co-lead with us, and that is what's happening. So I suppose it's important just to say to you, it's a good start, because it means that people have bought into this already themselves by voting on the top 3. Okay, could I have the next slide, please? Now, there are 7 tasks in Work Package 6, which is the work package on marketing of unhealthy foods to children. And Portugal and Ireland have split up these tasks, and I just mentioned that as I'm going through them. So the first task, 6.1, is the establishment of an EU expert group and national intersectoral working groups as well. So Ireland is going to be doing this, and in fact, Mimi, who's speaking to you later, will be on this expert group, and she's also going to be working with us on task 6.4, but more about that later. Then the second task, which Portugal are going to be leading on, is the mapping of existing regulations and legislation in EU member states and existing evidence on exposure and the extent of marketing to children of high fat, salt and sugar foods using the WHO Europe Nutrient Profile Model. I should have mentioned earlier that the reason why Ireland was invited to participate as a best practice country is we were one of the first countries in Europe, as Diane mentioned earlier about the Happy Meals, to stop the toys with Happy Meals and to not allow celebrity endorsement. Now, that regulation came out under the Minister for Communications, who was Owen Ryan at the time. So that was a really good start. But then after that, we have a code, a communications code for children, where for broadcast media, there are rules around high fat, salt and sugar foods, and these can't be advertised to children, and we say that's up to the age of 18. And the Broadcasting Authority of Ireland enforces that particular code. So we already had a code as well. So those are just 2 examples of things we've done. Plus, as you all probably know, we have codes of practice in relation to the non-broadcast media as well. Now, these are voluntary codes, and they cover marketing and also sponsorship and product placement. Next slide, please. And I suppose, I should have mentioned in relation to the Children's Communication Code that's regulated by the Broadcasting Authority of Ireland, we were one of the first countries to actually use a nutrient profiling model to do that. And as you know, a nutrient profiling model is how you can actually very fairly decide what foods are healthy and what foods are unhealthy. And without such a model, it's very difficult to actually enforce any kind of a code. So we followed the Ofcom UK model with one exemption, and that was cheese. And cheese was allowed to be exempt for social and economic and cultural reasons. Okay, so the next task then is task 6. No, sorry, back, sorry. Thank you, Andrew. The next task is the third task, and that is the implementation of the transposition of the new Audio Visual Media Services Directive. Now, all countries were supposed to have this up and running by July, and the important thing here is in relation to actually building in a nutrient profiling model into the actual the actual service itself, or the directive itself. So a number of countries haven't done that, so Portugal will be leading on that and trying to get agreement around that and have a harmonized approach in Europe. Next slide, please. Okay, then this is we're working on 2 major tasks in Ireland, and one of them is this one, the development of an EU-wide harmonized and comprehensive monitoring protocol for reducing unhealthy food marketing to children. And this work will look at reviewing existing protocols like the Nordic monitoring tool, Informus, and the WHO CLIC monitoring framework. And through looking at all of these, we hope to come up with an EU monitoring protocol. And next slide, please. And this slide I've stolen from Mimi, who's going to be talking later, because Mimi presented in relation to this work package, because she will be leading on this particular work package. And these are some of the examples of things that she's been working on in this area, but she'll be telling you more about that later. Next slide, please. Now, 6.5 is also the responsibility for Ireland, and that's guidance for regulatory and voluntary codes of practice. So what we're going to do there is help countries develop guidance for codes of practice on reducing unhealthy food marketing to children by providing them with assistance for developing the codes first, including a rationale as to why this is important, and then implementing the codes for broadcast and non-broadcast advertising of food and non-alcoholic beverages, and also in relation to sponsorship, retail, product placement, and other practices. And I suppose while the code, the Irish codes have been around for a while, there is a need to develop more practice guidance, and that will be a key part of this actual workshop and task for the food industry. And we will also be holding a workshop for member states in Dublin, and that's due to happen probably in 2022 or early 2023. So hopefully things will be back to some kind of normal by then, and we'll be able to go ahead with that. And Professor Ivan Perry in the School of Public Health and Centre for Health and Diet Research in UCC will be leading on this particular workshop. Next slide, please. Then, oh yeah, sorry, that was just a list of the things we're doing, but I've kind of gone through those. Next slide, please. Okay, task 6 is the adaptation of the monitoring tools to address health inequalities. So I suppose we wanted to make sure that in any of this work that we wouldn't make the gap between rich and poorer people bigger. So there will be a review of the health impact assessment of these interventions to help reduce unhealthy food to marketing, looking specifically at approaches differentiated by socioeconomic variables. And then if necessary, these tools will be adapted to address health inequalities. And then finally, the last task is 6.7, which is the development of an EU harmonized framework for action on reducing unhealthy food to marketing. So this will take all of the other tasks and bring them together. And the framework for action will then be produced and sent to the EU high-level group on nutrition and physical activity. And through this group, then further dissemination and practice will continue to happen, so that after the 3-year time frame, it won't just actually finish and that's the end of it. So the framework will include a range of all the actions, and will also include the farm to fork strategy recommendations, because they will have come in now and will be very important in terms of supporting all. Next slide, please. So this is the time frame. So we kicked off with the kickoff meeting 2 weeks ago. So it actually started the joint action on the 1st of October. It was due to start the 1st of April, but that was delayed. And then you can see it runs right up until September 2023. And next slide, please. And that's the end of the presentation. Thank you. And just a little paragraph there about the joint action, so that if you want to read in more detail, you can follow up on that later. And I must say, give my apologies. Unfortunately, I have to leave the workshop at 11 o'clock to join Minister Feehan for a meeting. So I won't be able to stay until the end. But if people put in any questions in writing, I'm happy to follow up with Catherine and answer them later if necessary. Or Mimi or Catherine may be able to answer them as well. Thank you very much.